Well, welcome, everyone, and this is your official notice that we're starting. I am Valeria Levy. I'm the Executive Director for North Carolina AIDS Action Network. And at North Carolina AIDS Action Network, our mission is to help increase the visibility and the mutual support of people living with HIV and AIDS and their affected communities through outreach, public education, policy, advocacy, and community building. At NCAN, we envision a state that values the voices, knowledge, and experience of people living with HIV and AIDS through judgment-free education and access to a supportive community. We understand that the position of North Carolina's Insurance Commissioner is instrumental to ensuring competitive rates, advocating for consumers, and addressing insurance fraud. So we're looking forward to a robust conversation this evening. Thank you all for joining us tonight, both in person and to our online community. And for those joining us in person, just a quick reminder to silence your phones. I'm going to take that notice myself. Without further ado, let me introduce you to our moderator for today's forum, the Health Advocacy Project Director of the North Carolina Justice Center, Nicole Dozer.
Good evening, everyone, and thank you, Valeria. I'm Nicole Dozier, and honored to be your moderator for tonight's forum. The North Carolina Justice Center staff works tirelessly, as you know, to attack poverty at its roots, centering equity, justice, and the people. So we know that insurance coverage that is affordable, that is quality, and that is comprehensive is at the top of North Carolina voters' lists. We also want to echo our partners across the state on the top of all of our minds and our hearts as North Carolinians, as Americans, is the loss, the devastation our neighbors are experiencing right now due to the hurricane. Our organizations are grateful that our two candidates for North Carolina Insurance Commissioner took time from their busy schedules to participate in the first and only event where they will help shed light for all of us on their positions on key issues. We've received a lot of questions for this event, so thank you. We did our best to incorporate them into the questions we're going to ask tonight. As a reminder, this is a nonpartisan, impartial, educational event. The views expressed by the candidates are not those of the North Carolina AIDS Action Network, the North Carolina Community Action Association, or the North Carolina Justice Center. Each of our candidates will share an opening statement, 3 minutes each. Then each will answer 8 to 9 questions, depending on time, that have been submitted online and live. 2.5 minutes each for those. Then we will take turns as they will take turns as I ask the questions. We'll wrap up the forum with candidates providing closing statements, 3 minutes each. And I wanted to let you know that the candidates themselves decided on who would go first. They decided Senator Natasha Marcus. I'll bring you up. We'll go first for the opening statement. I'll bring you up, Commissioner Causey. You will go first with the closing statement. So please join us. Thank you so much. I think both are enjoying just getting to mingle with all of you. So thank you so much for getting here early to do that. We go. All right. So I'm going to remind you, opening statements are 3 minutes. Can both of you see the timer there? So we have a time clock here, and we also have... Okay. But we also have...
Friend in the front row.
Mm-hmm. We also have our So right here you have the timekeeper. She'll hold up the sign, so I'll give you two. Okay. Okay, I can see that. Got you. All right. Thank you. Do our best. Senator Marcus.
Ready?
Ready.
Can everybody hear me okay? All right, good. Thank you all for squeezing in tonight to come here and talk about what I like to call the sexiest race on the ballot. It's the one everybody in North Carolina has been talking about. Can't wait to get to the polls and make your choice in the very exciting race of Commissioner of Insurance, right? So I'm Natasha Marcus, and I am the Democratic nominee for this position. I'm happy to be here to share my vision and my plans, my experience, and my reasons for running. I'm a former attorney, a mom of 2 adult daughters, and a current state senator serving from Mecklenburg County, now in my 6th year, serving on various committees, including the Insurance and Commerce Committee. And I have traveled the state extensively talking to voters about this race. And I say, hello, I'm Natasha Marcus. I'm running for Commissioner of Insurance. And often what I see back on their faces is a bit of a quizzical look. And they say to me, what is that? Or do we vote for that? And so I would like to make sure all of you in this room know, everyone listening knows, maybe you can tell a friend, because I think it's important that people know that if you pay an insurance bill in the state of North Carolina, you ought to care who your commissioner of insurance is, because we're one of only 11 states that allow the people to choose their commissioner of insurance. And this person is the sole person empowered by law with authority to decide if rates can increase for homeowners and auto insurance. And it's up to this single person. It's not a commission full of people. It's a single commissioner of insurance who makes that decision. And this person is elected because the person's supposed to work for the people of North Carolina, make sure that rates are fair and reasonable. And the reason I'm running is that I think, unfortunately, for the past 8 years, we've had someone in the role who is not looking out for the consumers the way the Commissioner of Insurance should. There's been 16 rate hikes during his 8 years in office. That's 3 times as many homeowners insurance rate hikes as his predecessor allowed. We used to have, for decades, the most affordable car insurance in the nation, and we have slipped out of the top 5. We're on a bad trajectory, heading in the wrong direction there. Consent to rate, which is something I hope we get time to talk about, is out of control. And insurance companies have been making record profits in North Carolina. And all during this time, my opponent has held not a single public hearing on a rate hike request. So we have 2 very different visions for this role. Mine is forward-looking. I'm ready to tackle the climate-related and economic challenges ahead. I am taking no money from insurance companies. That is my oath, to make sure I work for the people with no conflict of interest. And on the other side, I think we have someone who would like to take us backwards, frankly, to before the Affordable Care Act was enacted.
Thank you, Senator Marcus.
And, I see a stop sign. Okay, I'll stop there.
Commissioner Causey, 3 minutes for your opening statement.
Thank you, Nicole, and I want to thank you for putting on this forum. And Commissioner Goodwin, I don't know that you and I ever had this much fun when we were out campaigning. We got some attention, but probably not this much attention. But I'm Mike Causey. It's an honor and privilege for me to serve as your insurance commissioner. I was born on a dirt road produce farm in Guilford County, where I still live today, about 2 miles south of the A&T farm. And I'm all about consumer protection. Now, for the past 8 years, what I've done is follow the law. And North Carolina has a state law, and I've followed the same law that Commissioner Goodwin followed, Commissioner Long. And if you want to go back to taking the insurance companies to court every time, we had a commissioner that did that by the name of John Eagle. And I don't know, Commissioner Goodwin, you may correct me, but if I recall, I believe he went to court about 34 times and lost 31 times, and it was a disaster. And we don't want to end up like Florida and California. And I have worked with the companies to keep the rates as low as possible. And we certainly wouldn't want anything to go up. We don't want our groceries to go up. We don't want our fuel prices to go up. But inflation is here. And I think there are some insurance companies that would argue about those profits, because insurance companies are telling me they don't want to write homeowners insurance in North Carolina because they're losing money on what they have now. So it is a problem, but North Carolina is in good shape for insurance. We have one of the most healthy, stable insurance markets in the nation. And when it comes to automobile insurance, you can read the report from Forbes. They published the report earlier this year. North Carolina was 6th in the nation, only 5 states with lower insurance. We're the lowest in the Southeast for homeowners rates. So we're here to help consumers, and we're all about helping consumers every day. Thank you.
Thank you so much. So now we're ready to jump into the questions. So we're going to have 2.5 minutes to answer these questions, and hopefully we get through all of them. So the first one, Commissioner Causey, hold on one second, y'all. Okay, here we go. Okay. Due to the devastation caused by the hurricane, what should the commissioner's top priority be in responding to people's needs?
I just came from the mountaintop this afternoon. I was in McDowell and Burke counties, and Old Fort looks like a war zone. They have opened Interstate 40, thank goodness, is helping tremendously. But the town of Old Fort and all of western North Carolina depends on the railroad, and the railroad from Old Fort to Asheville is gone. I mean, it is literally gone. The tracks washed away. It is truly devastating. I have been on the phone ever since last week. We've had people on the ground with the Department of Insurance going door to door. We went to 144 homes last Thursday to get people out of their home to save their life. Not a single life has been lost in McDowell, but we've lost a lot of lives in Buncombe and some of the other counties. But this is a disaster of epic proportions, and we all have to come together, as the governor said this morning, to work as a team. And I'll be back up there tomorrow helping to get supplies, working with our first responders. And we've got folks all over the country coming in here to help North Carolina. And other states are having issues too, but none worse than what we're dealing with in western North Carolina.
Thank you. Senator Marcus, due to the devastation caused by the hurricane, what should the commissioner's top priority be in responding to people's needs?
It's hard to rank top priority. First, I do want to mention that I have heard the devastating reports out of Western North Carolina. I think we're all just really in a state of shock about how very bad it is out there. I know I get briefings as a state senator from various government agencies, and spoke today with Scott Mullins, who lives in Asheville and is the head of the Professional Firefighters Association there. And he told me a story that as they've been going door to door to save people, he literally found a body in a tree 30 feet in the air. That's how bad it is. So one thing that comes to mind when I think about storms like this one is how glaringly obvious it is that climate change is real and that it's happening, and that we ought to admit it and talk about it and tackle it. We can't just react and say, oh, well, that was a bad storm, and clean up from it and go on like the climate isn't changing. It is. One of the frustrations that I have with my opponent and his party is their refusal to admit that. And we have to have a commissioner of insurance who is ready to tackle the future challenges that we face. Storms like this are devastating, and more are coming. And North Carolina is particularly vulnerable. We have a long coastline, we have a lot of low-lying land in North Carolina, and now we're seeing flooding happening in the mountains too. And too many people don't have flood insurance. I'm very concerned about how many people are going to realize after they hopefully come out of it alive that there's no money there to cover their rebuilding costs. We have to expand, we have to encourage more people to get flood insurance. We have to do better with the flood mapping. The data we have is outdated. So a lot of people, even if they were trying to do what's right, they wouldn't know they were in a flood zone because the data is so old. Asheville's map is from 2010. So those are some of the things that we need a commissioner of insurance who's ready to look for. We also need to fortify roofs. We need a commissioner of insurance who's going to fight for consumers. Did you see 60 Minutes on Sunday about how there's people down there after the hurricane still fighting to get their insurance company to pay the claim that they are entitled to? I look forward to being a commissioner of insurance who's going to work.
Thank you,
for
Senator
consumers.
Marcus. So, Senator Marcus, as commissioner, what steps will you take to keep insurance affordable for homeowners and mobile homeowners and mitigate the harms of rate increases?
So I alluded to it a little bit in my opening, but one of the main things we need to do is bring back the public hearings. So I'm not talking about a court proceeding. That happens later if there's an appeal. What I'm talking about is the public hearing on a rate hike that has not happened in 8 years under my opponent. And the reason these are so important is that it is all about transparency. To me, one of the most important, particularly maybe the most important job of the Commissioner of Insurance is to make sure that you find that balance between reasonable profits for the insurance companies. And let's be clear, they're entitled to reasonable profits. We want them to make a reasonable profit, so they'll write policies here and want to do business here. But they're not entitled to make record profits or charge whatever they want. It's a regulated market on homeowners and auto because we're required to have those parts, that type of insurance. And so you got to find the balance. Reasonable profits on one side, yes, but affordable, fair for the North Carolina consumer. And without a public hearing, there's no way to pick a fair number. The reason we have a public hearing, let's be clear, that's when insurance companies come before the Commissioner of Insurance, who sits like a judge and forces them to justify with data under oath, subject to cross-examination, why they think rates need to go up and to what number. Commissioner of Insurance has staff, the auditors and folks on staff there at the DOI who can cross-examine that evidence and say, wait a minute, State Farm, you're saying you paid out how much in claims? That's not what we show. And only after these hearings, which can be lengthy on a homeowner's rate hike, they could last 3, maybe 4 weeks, only after all that happens can the public understand why a rate would need to go what it is. And honestly, the Commissioner of Insurance would have the correct information to say what the new number should be, and only then should he sign a consent order and agree to let rates go up on North Carolinians. We also need to get a handle on the consent to rate loophole, which is allowing insurance companies to charge 250% above the maximum rate to now many as 45% or so of policyholders in North Carolina are getting hit with a consent to rate. They don't even realize it's happening. My opponent never talks about it because the insurance companies love it.
Thank you, Senator Marcus. Commissioner Causey, what steps will you take to keep insurance affordable for homeowners and mobile homeowners and mitigate the harms of rate increases?
Thank you. First, I want to mention the consent to rate. The consent to rate was passed by the North Carolina General Assembly. Senator Marcus has been a state senator for at least 6 years. I've never seen any legislation introduced to address the consent to rate. But the reason the legislature passed consent to rate in the first place, and I came into that, was to keep insurance companies from pulling out of North Carolina. And if we did not have some type of consent to rate, we'd be like Florida and California. So on the public hearings, when whoever the insurance commissioner is, has to follow state law. And I follow the same process as my predecessors, and we had a public hearing. If you go to this year, when that rate filing came on your homeowners, the first thing I did was schedule a public hearing for January 22nd. We had it at the Jim Long Hearing Room in the Albemarle Building. And I kept the public comment period open for 2 weeks. And I received more than 25,000 letters and emails from the public, from county commissioners, from city council members, from our whole congressional delegation. And everybody said the same thing. Inflation is killing us. We can't afford groceries. Fuel prices have doubled or tripled. Please say no to the rate increase. And I said no, and when you say no, state law tells the insurance commissioner, when you say no, you have to set up the court date, is what the senator's calling the public hearing, and we're having that on Monday. This coming Monday is the public hearing court date for that homeowners. And that could go on for who knows how long, so thank you.
Thank you. Commissioner Causey, can you talk about your experiences, skills, and areas of expertise that make you the ideal candidate for leading the Department of Insurance?
Thank you. Yes. I started out in the construction engineering field, worked as a field engineer with a large dental contractor, went back to college, and was recruited into the insurance business. So I grew up in the insurance world. I started out at the bottom as an agent, worked as an agent, later became a sales manager, and had an agency, became superintendent of agencies for a smaller company. So I've seen the insurance world, particularly in health insurance and life accident and health. And I know that, we have states where the insurance commissioner is appointed by the governor. Or in the case of Virginia, the insurance commissioner is appointed by a committee. But I like the fact that the people get to vote on the insurance commissioner. I'm glad the people have a choice this year and have competition. But I have 8 years of experience in working with the industry, and I have every day stood up for consumers in this state to fight for consumers. We help seniors every day through our Seniors Health Insurance Information Program and our other programs. And most of the commissioners that I know all around the country, regardless of party affiliation, operate in a nonpartisan manner, and that's exactly how we operate the Department of Insurance here in North Carolina.
Thank you. Senator Marcus, can you talk about your experiences, skills, and areas of expertise that make you the ideal candidate for leading the Department of Insurance?
Yes, I'm the only candidate in this race who has legislative experience, which I think is key to understanding how our state government works and what the powers and authority is of the Commissioner of Insurance. I'm also the only candidate with a law degree. I have represented people in court, a court-like setting, like the public hearings that I am asking the Commissioner of Insurance to hold. Let me take this moment to clarify. He said he held a public hearing. No, he held what was required, which is a public comment session. I was there, he was not, to listen to North Carolinians come from all over the state to talk about how the current proposed homeowners rate hike would hit them hard. That's not what I'm talking about. I'm talking about the under oath cross-examination data that insurance companies should have to present in a court-like setting. I have experience in a court setting as a former litigator. I am eager to have those hearings, and I'll do it if you elect me. I have a good working relationship with many key leaders in our state through my Senate work, with the governor, with the Attorney General, other Council of State members. And I am, importantly, free of any entanglements with the insurance companies. You'll notice my opponent is very pleased with his close ties with the insurance companies. I think that's part of the problem here. He talks about how he likes to work with them. And I believe the job is to have a little bit of an adversarial relationship with the Rate Bureau and the insurance companies, because your job is to work for the people of North Carolina who need reliable and affordable insurance and consumer protections. So I think it is a positive that I am not entangled with them, not taking campaign money from them, and also will not give plum positions at the Department of Insurance to my friends and political cronies who are not qualified to be working at the Commissioner of Insurance's office at the Department of Insurance. That has been something widely reported and has never been fully explained, why the state taxpayer is spending so much money to pay for a private chauffeur, to pay for people with make-work jobs within the Department of Insurance. I have a leadership style that is free from that kind of influence and will do what's right for the people of North Carolina.
Thank you. Senator Marcus, regarding a state-based exchange for health insurance, what do you consider to be the most important factors for ensuring ease of use, affordability, and accessibility for North Carolina?
So that's a really complicated question. Just to set the stage, so that's something that the Affordable Care Act envisioned that all states would do when it first passed. They envisioned every state would expand Medicaid because there was federal dollars to cover, and that should have been a no-brainer to cover people with the tax dollars we've already sent to D.C., and to set up a state exchange, which is a more local way for people to have access to insurance. So I supported both from the get-go. At the time it came out, I was actually a volunteer at a community center in Davidson, where I live, that had a free clinic for people who worked jobs but couldn't afford to see a doctor because they didn't have insurance. And this is exactly the kind of program that would have filled that gap for those people. So when I got to the Senate, I fought very hard under the governor's leadership to finally expand Medicaid and believe we should have a state exchange. I believe the previous commissioner of insurance was ready to start that program until the General Assembly shut it down. So that would be one more way for people to insulate North Carolinians from what happens up in Washington. So during the Trump administration, people of my opponent's party wanted to do away with the entire Affordable Care Act. That would be a disaster for North Carolinians. And I hope my opponent has changed his opinion on the Affordable Care Act and that we would never try to do that anymore. But I do worry what happens at the federal level. So a state exchange would be important. We'd have to make sure that the insurance companies didn't have too much influence over those boards. We'd have to have various people, stakeholders in the industry. And I would look to organizations, honestly, like the ones hosting this forum, for good ideas. I know there's policy papers that you all have put out and others that caution how you do it. You have to be careful how you do it. And so I would love to move in that direction with the advice of experts.
Thank you. Commissioner Causey, regarding a state-based exchange for health insurance, what do you consider to be the most important factors for ensuring ease of use, affordability, and accessibility for North Carolina?
We have a state-based exchange that we developed. The legislature did pass legislation to require us to go that direction. Georgia implemented it first, and we got the language drawn in record time. We're ready to go. I favor it. I think it's a good idea. I think it's good for the people. And I think the Affordable Care Act has been a blessing to many people, and we work with it every day. We have folks in our Life and Health Division that help consumers with any issues they have under the Affordable Care Act. And I believe the state-based exchange will save us a lot of money. I'd rather see it staying here in North Carolina than going up to the federal government. So we work with folks every day helping people find coverage, whether it's through the Affordable Care Act or wherever we can get help. But our mission is to help consumers, and that's what we do every day, and that's what I've been all about for the past 8 years and will continue if I'm fortunate enough to be reelected. Thank you.
Thank you. Commissioner Causey, what is your opinion of public participation in the rate review process for insurers?
I'm all about the public participation. The public hearing that Senator Marcus wants is happening this coming Monday, October the 7th. It's been widely publicized, but every single time, regardless of whether it's automobile insurance, mobile home insurance, dwelling insurance, whatever the type of insurance is, when we get notification from the North Carolina Rate Bureau, and let me remind everybody, the insurance commissioner in North Carolina does not set insurance rates. We're a rate bureau state. The rate bureau was created by the General Assembly in 1977, and regardless of who the insurance commissioner is, the law of North Carolina has to be followed, and the commissioner has to make sure rates are adequate. That's the key word, adequate, for that insurance company to pay claims and remain solvent. And then if they're excessive or unfairly discriminatory, I said to the homeowners, no, these rates are excessive and unfairly discriminatory. We set the court date. The public hearing that the senator talks about is coming up Monday. And when we had the public comment hearing, I wanted to be there really bad, but the attorneys at the Department of Insurance and the Attorney General's office said you cannot go. And so on the advice of the attorneys, because of our role, we weren't there. But the consumers know where I stand, and that's on the side of the consumer. Thank you.
Thank you. So, Senator Marcus, what is your opinion of public participation in the rate review process for insurers?
I'm pleased to see that we're going to maybe have our first public hearing. I hope that it will go forward. Every other time that my opponent has said there will be a public hearing on a rate hike, it gets canceled at the last minute, and instead he meets privately with insurance companies and agrees to raise rates. And he likes to say the insurance commissioner doesn't set rates. That is a very curious way of saying avoiding, I guess, the job. Another way to say it is that without the approval of the insurance commissioner, rates cannot go up. So I understand that the Rate Bureau initiates the process of requesting a rate hike, but it's up to the insurance commissioner in the end to say yes or no, or what the new rate's going to be. And I believe, here's an example. I brought this just in case because I'd heard he might say he doesn't set the rates, but this is your signature on the most recent homeowner's rate increase. That's the consent order, and that's his signature. And without his signature, the rates wouldn't have gone up. So I don't really know what point he's trying to make there. I do hope the hearing goes forward on Monday, so we will, for the first time in 8 years, have some transparency about the data. And I think a commitment to transparency is so important here, because if the public is allowed to make comments in a session where the Commissioner of Insurance isn't even there, and that's it, then that's not really doing the job of representing the people of North Carolina. Not when we have these private settlements that there is no data, there is no recording of what happens during those private settlement meetings. And we know that he is taking, so far, $250,000 from insurance industry sources to help him get elected for his campaigns. It's legal. Let me be clear. That's legal for him to do that. I see that as a conflict of interest, though. And one more reason why we should have a public hearing to decide whether the data justifies a rate hike or not. And if the data justifies a rate hike, so be it. I'm not going to sit here and lie to you and say I will never have a rate hike ever, because we don't want the insurance companies to leave our state. But right now, he's just taken their word for it. They threatened to leave. They're not leaving, folks. They are making record profits.
Thank you, Senator Marcus. Senator Marcus, what do you believe are necessary steps to take to increase competition and improve affordability to health insurance for seniors?
So seniors have, happily in our country, access to Medicare, and it's very good coverage. And with the help of the Biden administration, the Inflation Reduction Act has now capped insurance costs for the first time, starting just now. This is a recent change to $2,000 per person for medication, prescription drugs. And that's so important. It's also important that to note that the Biden-Harris administration allowed for the first time for Medicare to be able to negotiate prescription drug prices. And we don't know why it took so long, but we're glad it's here, and that is going to bring down costs as well for seniors. Another thing that may seem unrelated, but I believe is related, is our push to expand Medicaid by bringing down the uncompensated care in the state of North Carolina. That brings down everybody's insurance premiums, because otherwise that uncompensated care gets charged back to people who do have insurance. So I am, again, very proud of the way we stood together as Democrats behind Governor Cooper and made sure the Medicaid expansion happened here in North Carolina. Some other maybe more detailed parts that I support as a senator would be reforming the PBMs, the pharmacy benefit managers, which I believe raise the prices. There's the 340B drug pricing program that is kind of a monopolistic way of pricing things. And the SHIP program is so important. So that's directly under the Department of Insurance. That needs to be reinvigorated. The Seniors Health Insurance Information Program, because it should be a resource for seniors to make sure they know what their options are and how to find an insurance agent who is not going to sell them the wrong policy for them. It's so important that we have honest brokers working with our seniors to make sure they get the coverage they need. I had one more idea. Oh, this isn't directly related, but I wanted to mention how important it is that the Commissioner of Insurance is in charge of regulating the CCRCs, the continuing care retirement centers, and how that is not necessarily insurance, but the investment that you make in a CCRC should be secure because it
Thank you, Senator Marcus.
So,
Commissioner Causey, what do you believe are necessary steps to take to increase competition and improve affordability to health insurance for seniors?
some of the same things that we've been doing for the past several years, but I'm just interested to know that the Melinda Munden heads up our SHIP division. She's been with the department for many years. I think that she'll be really surprised that the SHIP program needs to be reinvigorated. It's one of the best programs in the state. We have volunteers in all 100 counties, and we're out there in senior centers helping seniors every day. So the SHIP program is in great shape. The seniors love it, and all I hear are positive comments about it. And as far as the rate hike thing,
Yes.
I don't mind at all negotiating a settlement, whether it's automobile insurance or homeowners. Automobile insurance, the insurance companies wanted to raise across the board your car insurance rates more than 30%. We did negotiate a settlement, and the settlement was 9% split over 2 years. It was 4.5% last December, 4.5% this December. Now, you can go to court, have that hearing. You may or may not win. It may drag on for years, but the thing about going to court, what's called a public hearing, it's very costly, expensive, can cost millions of dollars, and we're proud of our record. Now, we can't help how often the Rate Bureau does a rate filing, and I've criticized the industry. I think when Commissioner Goodwin was there, they would have a filing, but Fred Fuller, that heads up our property casualty division, says the industry sometimes waited 6 or 7 years between rate filing. You can't wait that long. The public can take incremental changes. They can't take what they did in January, filing a homeowner's rate increase with a 42% across the board average. And folks on the coast were looking at almost 100%, 99.4. So I'm proud of my record for holding down the amount of increase. I cut it from what the industry wanted. And if you go look at how many millions and millions of dollars that saved consumers, and plus we, under our leadership, 80% of our fire departments
Thank you,
have
Commissioner Causey.
class ratings.
Okay. Okay. Commissioner Causey, what steps should the Department of Insurance take to prevent the fraudulent enrollment of people into health insurance plans without their knowledge?
That is a huge, huge problem all over the country. I met with a group of agents that said there was a group of folks in Florida just going on the internet, taking your name, your social security number, and they're signing people up to the Affordable Care Act without knowledge. And sometimes people will have 8 or 10 policies. We have a criminal investigations team that's one of the best in the country. We are going after fraud every day. I've more than doubled, nearly tripled the number of sworn law enforcement officers we have in the field fighting fraud. We have 12 agents that are sworn as United States Marshals working with the FBI. We do Social Security Administration fraud, Homeland Security fraud, Medicare fraud investigations, and the healthcare industry is really riddled with fraud. And nearly half of the claims that are submitted in some of the Medicare and Medicaid claims are fraudulent. So it's a never-ending problem. It's just like the scams that are out there. We're all trying to get scammed every day. If you look at your text messages, your email, but we ask people if they suspect fraud, report it. we'll go after it. We'll investigate it, but we have to be very aggressive in pushing this back to protect consumers, especially our seniors.
Thank you. Senator Marcus, what steps should the Department of Insurance take to prevent the fraudulent enrollment of people into health insurance plans without their knowledge?
Yeah, so
Still. Try again? Okay.
but tattoo. That's good.
Oh, okay. I see.
Hello again. Hello.
Ningo.
Yes.
Thank you, Tim.
So that I agree. It's a big issue. I spoke with agents in various cities. Specifically, I remember a conversation with a gentleman in Greensboro who described this practice as almost, what did he call it? Almost harassment. He said the number of phone calls that as soon as you turn 65, apparently, I'm not there yet, but apparently once you turn 65, you start getting harassed by these companies, sometimes out of state and sometimes out of the country, calls coming in, and they come into seniors and they try to sell you a policy that's not right for you. And so what can be done to stop that? Because we don't want anyone, let alone our seniors, getting talked into a policy that's not right for them. What can we do about that? Well, we clearly need to do more because it's rampant. So one option would be to have robust spot checks. So the Commissioner of Insurance has the authority to check all new enrollees. You could do it by company, and you could check in with them and say, how were you contacted to enroll in this program? And if they were contacted with a cold call, that's illegal in North Carolina, and we ought to be reporting that. I don't know that we have the data because I don't think there have been those kind of spot checks. We need to have an audit run to look for patterns and evidence of fraud. Sometimes these same companies are doing it in various states. So the seniors, not just in North Carolina, but elsewhere. So I would like to coordinate, engage with other commissioners of insurance in other states and find out, is this happening there? Are you conducting these spot checks and audits to look for these patterns? Are you talking to these seniors who enroll in these new programs to find out how they were contacted? It's already illegal for these calls to come to the home unsolicited. And this is clearly not being enforced, and the Commissioner of Insurance needs to do more to stop it from happening.
Thank you. So now we're ready for closing statements. As a reminder, each of you have 3 minutes, and I'm going to begin with you, Commissioner Causey. Please share with us your closing statement.
Thank you. And one of the first things I did when I took office January 1st of 2017, when I got to Raleigh to the Department of Insurance, I met with the Criminal Investigation Division about fraud. And it's a huge problem. And I asked, what do they need? They said we could use more sworn officers, and some of these fraud cases weren't getting heard in the courts. In some of the counties, they get pushed to the side. And we were kicking around ideas, and I said, what if we hired experienced prosecutors and have our own legal prosecution team? And we did that, and that was a game changer, because last year our criminal investigators arrested over 505 people, a record, and we actually took a lot of those to court, and we prosecuted successfully, got convictions on more than half of those, and the others are pending now. And one of those turned out to be a first-degree murder case down in Gaston County. So you never know where insurance fraud may lead. So we've led the nation in the fraud, going after insurance fraud. I work with all the commissioners in all 50 states. I'm active in the National Association of Insurance Commissioners, and every commissioner in the Southeast has reached out to me this week to help see what they could do to help in North Carolina. But it will be my honor and privilege to serve you for another 4 years to continue the good work that we've done. I'm not sure about some of that other misleading information that came about or where it came from, but if anybody has any questions, I have an open door policy. You can email me directly at mike.causey@ncdoi.gov and ask me any question you want to, and we'll get an answer. And I do have to follow my general counsel legal's advice, so sometimes I can't answer everything. So thank you, and thank you, Nicole, for hosting this, and the Justice Center for hosting this.
Thank you, Commissioner Causey. Senator Marcus, please share with us your closing statement.
Sure. So thank you again for all coming to hear more about, again, sexiest race on the ballot, right? So interesting. Some people think insurance is going to be boring. It's not boring. This is interesting stuff. Everybody in North Carolina's wallets are impacted by this race. And I'm thinking more and more voters are noticing that. I just want to emphasize how much it is my focus, my North Star, to look out for what's best for North Carolina consumers, not for insurance companies, but for consumers. I don't want to work for them. I want to work for the people. I'll bring accountability and transparency, both of which I believe have been lacking without these public hearings and without even really admitting that the Commissioner of Insurance is the one that has the final say on whether to sign these rate hikes or not. I also think it's important we have a Commissioner of Insurance who will talk about the real impacts of our ever strengthening storms. I will note that I have never heard my opponent say the words climate change or talk about it. He didn't tonight. And that to me is a big gap in what we need in a Commissioner of Insurance. I am proud to have the endorsement of the professional firefighters and paramedics of North Carolina, the Charlotte firefighters, the Sierra Club, the Climate Cabinet, all of whom understand how important it is that we have a new Commissioner of Insurance who will work with those groups and be aware of the issues that we face. I have filed a bill to study consent to rate. I guess my opponent's not aware of that, but I think that is a critical part of protecting consumers in North Carolina. It makes a mockery of a regulated market to say that to be happy, to allow insurance companies to charge you 250% above the maximum rate. And all they have to do is put a notice somewhere in the back of your bill. Again, my opponent has called that freedom for insurance companies, saying that that's a good thing. I disagree. I think it's a gaping hole and a giant loophole that we need to address because it's not fair for North Carolina consumers. I understand that the insurance market is tricky, but we need someone in this role who is not going to just believe the threats of insurance companies and give them what they want by them saying, oh, well, you don't want to be Florida. They are making record profits in North Carolina under Commissioner Causey, and they want to keep him there. That's why they're putting money in his campaign coffers. They want to continue to make record profits here. They're losing money in other states and charging us more to make up for that. And that's exactly what our elected Commissioner of Insurance in North Carolina is supposed to protect us from. Thank you all for your time tonight.
So Commissioner Causey, Mike Causey, Senator Natasha Marcus, thank you all for being here this evening again. And what I'm going to do next is I'm going to bring our partner up, Sharon Goodson, to close us out. But I also want to recognize we have some former and current elected officials joining us. And so just give a wave. Thank you for taking time out of your busy schedules as well. So Sharon?
Thank you. Thank you so much, Nicole. I am Sharon Goodson, the Executive Director for the North Carolina Community Action Association. The North Carolina Community Action Association, it is a trusted and proven advocate for a statewide network of 33 community action agencies. We are here to give voice to the needs and concerns and the stories of North Carolina's disadvantaged and low-income citizens, and as well as to shed light on the collective impact of our statewide network of community action agencies. The North Carolina Community Action Association, we collaborate with community members, with local governments, with public and private partners, and thousands of local volunteers to invest in a holistic community-based approach to anti-poverty strategies. We want to thank the candidates for their participation in this forum and for their thoughts and responses to the questions asked this evening. This is a perfect opportunity to remind everyone that the comments that you've heard from our candidates, that they do not reflect those of the sponsoring organizations. We want to thank the people who came out. Thank you for joining us this evening. We also want to thank our folk who are visiting with us or joining in online or participating online. One last reminder, we want to remind you to please vote in the upcoming election. You can start now by making a voting plan. Please make sure you include in that plan, including to make sure that you have a valid voter ID. Voter registration deadline is October 11th, but you can also do same-day registration doing early voting, which begins on October 17th and runs through November 2nd. And Election Day is Tuesday, November 5th. No same-day registration on that day. The information is on your program, and there is the information is also on the slide for those who are watching us online. On your program is a QR code where you can check your voter registration status, as well as find your early voting and Election Day voting locations. Again, we want to thank you for joining us. Thank you to the candidates, and good night.